Good afternoon. This is Dr. Samango-Sprouse talking on the novel neurocognitive profile in a minority of males with 47XXY or Klinefelter syndrome. I have no disclosures. We are looking at an alternative neurocognitive profile that is observed in a subset of boys with 47XXY. We know that it is a common disorder. 75 to 95%, 90% are never diagnosed, and there's wide variability. They are characterized by having language-based disorders, mild childhood apraxia of speech, increased receptive language, and delayed complex motor skills. Over the years, starting with Bender in 1986 and Graham in 1988, it's been described that they had increased performance IQ and decreased verbal IQ. The report data also now shows that there's a 10% decrease in the size of the caudate nucleus in males with this disorder, and this is highly linked to the mild childhood apraxia of speech. The region is also responsible in the parietal lobe for visual, spatial, and perceptual abilities. What influences the neurodevelopmental profile? Pre- and postnatal diagnosis, family history, hormonal replacement, among others. Our purpose was to identify and describe these children who had higher verbal capabilities in comparison to perceptual and explore the differences between the two groups. We had 55 children. We separated them based on their verbal IQ, which had 17 children, and their performance IQ, which had 38. We then looked for variabilities, commonalities, as well as differences. Figure weights from the WISC showed that the PIQ, children with higher PIQs performed better. PIQ kids also showed increased scores in block design, matrix reasoning, picture concepts, information, visual, spatial, and fluid reasoning. Some of this makes sense because of the higher PIQ, but not all of it, such as information. We looked at them on nonverbal testing, and we showed that the PIQ children, as expected, had increased scores in comparison to the children with increased verbal scores. We looked at them in comparison to vocabulary, and we found there were no differences between expressive and receptive vocabulary in either group, VIQ or PI group. Now it is important to understand, what does this mean? The majority of our participants, as expected, had higher VIQ scores. That's been described in the literature for over 40 years. But there's a subset of children, about 33%, who have heightened verbal capabilities than their perceptual. They were commensurate, VIQ and PIQ groups, in expressive and receptive vocabulary. It suggests that the vocabulary abilities may be age dependent and that they increase with time, and we see them normalized by school age. These differences also suggest that individuals with higher PIQs may potentially show differences in their brain and regional development than the children with higher VIQs. Limitations: there's predisposition to ascertainment bias in all studies with boys with 47XXY because 75% of those individuals are never diagnosed in their lifetime. So we're reporting on those children that are identified, but are still only 25% of the population. We normalized and minimized all confounding factors such as vaginal versus cesarean delivery, birth weight, and a variety of other things that could have impacted on our findings. Future directions: treatment for every child with 47XXY needs to be individualized based on their profile, and that profile needs to be completed by someone who's familiar with their genetic disorder. Clinicians should identify the specific profile and develop optimal interventions based on these variations across all domains of development. Further research is needed to look at structural brain differences in patients who have the two different kinds of profiles. We'd like to acknowledge all the families who have assisted us, and we thank the Journal of Developmental and Behavioral Pediatrics for providing us the opportunity to share our information. Thank you very much.